What attracted you to outpatient nursing specifically, as opposed to an inpatient setting?
One of the most compelling aspects of outpatient nursing for me is the distinct opportunity to foster patient autonomy and education. In an inpatient setting, the focus is often on acute care and immediate stabilization, which is undeniably vital. However, outpatient care offers a different kind of fulfillment, the chance to partner with patients over time, empowering them with the knowledge and skills they need to manage their health proactively. I'm drawn to the emphasis on health promotion and disease prevention, where nurses play a pivotal role in guiding individuals through lifestyle modifications, medication adherence, and understanding their chronic conditions outside the crisis of a hospital admission. Furthermore, I appreciate the faster pace and the diverse range of cases encountered daily in an outpatient department. It demands quick, critical thinking, efficient time management, and the ability to rapidly assess and prioritize different patient needs. This dynamic environment, where I'd often be the first point of contact for patients seeking answers or care, aligns perfectly with my problem-solving approach and my desire for continuous learning. The greater independence and direct patient interaction involved in telephone triage, patient education sessions, and assisting with minor procedures are areas where I believe my skills truly shine. Ultimately, I'm eager to contribute to a setting where continuity of care is paramount and where I can build more sustained relationships with patients, witnessing their progress and positively impacting their long-term well-being.
Outpatient nurses often manage a high volume of patients. How do you prioritize tasks and manage your time effectively?
Managing a high volume of patients in an outpatient setting demands a structured and adaptable approach to prioritization and time management. My strategy begins even before the shift officially starts by reviewing the day's schedule to anticipate patient flow, identify complex cases, and note any specific preparations required. This proactive review allows me to mentally triage and allocate initial time blocks. Once the day is underway, I employ a continuous assessment model, prioritizing tasks based on acuity and urgency. I consistently ask myself which patient needs immediate attention to prevent deterioration or ensure safety, and which task, if delayed, would compromise patient care or clinic efficiency. This often means addressing acute symptoms or critical medication administrations first, followed by time-sensitive procedures, and then routine assessments or patient education that can be batched together. Effective time management for me also involves meticulous organization and clear communication. I utilize electronic health records efficiently, documenting in real time to avoid a backlog. Clustering care, where multiple interventions are performed during a single patient interaction, minimizes redundant trips and maximizes patient face time. Furthermore, I believe in transparent communication with both patients and colleagues. Keeping patients informed about potential wait times or the flow of the clinic helps manage expectations and reduces anxiety. Similarly, clear handoffs and collaboration with support staff and physicians are crucial for smooth transitions and shared workload management. Ultimately, flexibility is key. While a plan is essential, the ability to rapidly reassess and adapt to unforeseen circumstances, which are common in a busy outpatient department, is paramount to maintaining high-quality, efficient care.
Describe your process for teaching patients about self-management, medication adherence, and follow-up care.
Self-management, medication adherence, and follow-up care are the cornerstones of successful outpatient outcomes, and my teaching process is designed to be comprehensive and patient-centered. When I sit down with a patient like Mr. Thomas, a 62-year-old recently diagnosed with type 2 diabetes, my first step is always to assess his current understanding and readiness to learn. I'll ask open-ended questions like, what do you currently know about diabetes, or what are your biggest concerns about taking new medications? This helps me gauge his health literacy and identify any immediate anxieties or misconceptions. Next, I break down complex information into digestible, manageable chunks, avoiding medical jargon wherever possible. For Mr. Thomas, I'd explain how diet and exercise impact his blood sugar in simple terms, using analogies if helpful, perhaps comparing his body to a car needing the right fuel. When discussing his new metformin prescription, I wouldn't just list the dosage. Instead, I'd walk him through the why, explaining how it works to lower his glucose, the how, demonstrating the best time of day to take it with meals, and the what if, outlining potential side effects and what to do if they occur. I always encourage patients to ask questions throughout this process, using techniques like teach back, where I ask them to explain the information back to me in their own words. For example, Mr. Thomas, just so I know I've explained everything clearly, can you tell me in your own words how you'll take your metformin? This ensures true comprehension, not just passive listening. Finally, I emphasize the importance of follow-up care and provide clear, actionable steps. For Mr. Thomas, I'd ensure he has his next appointment with the endocrinologist scheduled for August 12, 2025, and understand why these regular check-ins are crucial for monitoring his progress and adjusting his treatment plan. I'd also discuss the availability of resources like diabetes education classes at the hospital or online support groups. I provide written materials, such as a personalized medication schedule and an easy-to-read pamphlet on healthy eating for diabetics as a reference. My goal is to equip patients not just with information, but with confidence and a clear path forward in managing their own health effectively.
How do you handle patients who are non-compliant with their care plan or seem overwhelmed?
Handling patients who are non-compliant or seem overwhelmed requires a blend of empathy, skilled communication, and a systematic approach. My primary philosophy is to understand the why behind their behavior, rather than simply labeling them as non-compliant. Often, non-adherence isn't a deliberate defiance, but a symptom of underlying challenges. When a patient appears overwhelmed, my first step is to create a calm and supportive environment. This might involve finding a quieter space, ensuring privacy, and actively listening without interruption. I'll use empathetic phrases like, "It seems like a lot is on your mind today," or "I can see this might feel overwhelming." The goal is to validate their feelings and build trust, encouraging them to verbalize their concerns. I'll then try to identify the specific stressors. Is it financial burden? A lack of understanding about their condition? Difficulty managing medication schedules? Fear of side effects? Once I have a clearer picture, I can begin to address the specific barriers. For noncompliance, my approach is similar. I start by reviewing the care plan together, asking open-ended questions like, "What has been challenging for you with this medication?" Or "What are your thoughts on your current treatment?" I never assume they fully understood the initial instructions or that their living situation allows for perfect adherence. For instance, a patient with a complex medication regimen might benefit from a simplified schedule, a pill organizer, or even a referral to a pharmacy service that offers pre-sorted blister packs. If cost is a barrier, I'll explore options like generic alternatives or direct them to social workers who can assist with patient assistance programs. I also emphasize the why behind each recommendation, explaining the potential consequences of non-adherence in a non-judgmental way and the benefits of following the plan. The teach-back method is invaluable here, asking them to explain their understanding of the plan in their own words, ensuring clarity. Ultimately, my aim is to collaborate with the patient, adapting the care plan to their individual circumstances and empowering them to take ownership of their health journey, rather than imposing a one-size-fits-all solution.
Outpatient settings often involve a lot of phone triage and telehealth. What is your experience with providing patient care and education remotely?
In the contemporary healthcare landscape, phone triage and telehealth have become indispensable tools in outpatient settings, and I have extensive experience in both areas, allowing me to provide comprehensive patient care and education remotely. My proficiency in phone triage has been honed through numerous shifts where I've been the primary point of contact for patients calling with a wide range of concerns, from acute symptoms to routine questions about medication or appointments. My process always begins with active listening to fully grasp the patient's chief complaint and initial assessment of their urgency. I then systematically gather relevant information, including their medical history, current symptoms, and any red flags, using a structured questioning approach, while simultaneously building rapport and reassuring the caller. Based on this assessment, I can then effectively triage, advising on self-care measures, scheduling an urgent in-person appointment for the same day, directing them to the nearest emergency department if critical, or arranging a telehealth consultation. My strong clinical judgment ensures that patient safety remains paramount while optimizing clinic flow. Regarding telehealth, I have a solid track record of conducting virtual consultations, primarily using video platforms. This involves preparing the patient for the virtual visit, ensuring they are in a private setting, and guiding them through any technical requirements. During the virtual encounter, I am adept at utilizing visual cues as much as possible, asking patients to demonstrate symptoms or show affected areas where appropriate. Patient education in a remote setting requires particular skill. I break down complex information into easily understandable segments, use visual aids shared on screen when necessary, and consistently employ the teach-back method to confirm understanding. For example, if explaining a new nebulizer to a patient with asthma, I might share a demonstration video or have them practice the steps on their end, guiding them verbally. I also ensure that all follow-up instructions, prescriptions, and referral information are clearly communicated and sent electronically. My experience with these remote modalities has taught me the critical importance of clear, concise communication, technological proficiency, and maintaining a high level of empathy and professionalism, even without direct physical presence, to ensure patients receive seamless and effective care.
Describe your experience with common outpatient procedures.
My experience encompasses a comprehensive range of common outpatient procedures, all performed with meticulous attention to detail, patient comfort, and adherence to sterile technique. I am highly proficient in wound care, from assessing and cleaning various types of wounds, be they surgical incisions, diabetic ulcers, or minor lacerations, to applying appropriate dressings and providing detailed instructions for home care. I've managed complex wound cases, including negative pressure wound therapy setups, and consistently educate patients on signs of infection and proper hygiene to promote optimal healing. In terms of injections, I am skilled in administering a wide array of medications via subcutaneous, intramuscular, and intradermal routes. This includes everything from routine vaccinations and insulin administration to specialized injections like B12 supplements or specific biologics. I always prioritize patient comfort, employing techniques to minimize pain, and I am adept at educating patients on self-injection techniques for long-term conditions, ensuring they feel confident and competent. My expertise extends to IV therapy, where I am proficient in venipuncture for initiating peripheral fore access, administering for fluids, and infusing various medications, including antibiotics and pain management drugs. I am meticulous about site selection, vein preservation, and continuous monitoring for potential complications such as infiltration or phlebitis. My experience also includes discontinuing 4 lines and providing thorough post-procedure care and education. Furthermore, I have considerable experience with blood draws phlebotomy for diagnostic testing. I am adept at quickly and efficiently obtaining samples from diverse patient populations, including those with challenging venous access, always prioritizing patient comfort and minimizing discomfort. I ensure proper labeling, handling, and timely delivery of samples to the lab, understanding the critical role accurate specimen collection plays in diagnosis. Finally, I have actively assisted physicians and performed independently on various minor procedures common in outpatient settings. This includes suture and staple removal, ear syringing, basic splinting, and assisting with punch biopsies or aspirations by preparing the sterile field, ensuring all necessary instruments are available, and providing patient support throughout the process. In all these procedures, my focus remains on patient safety, effective communication, and delivering efficient, high-quality care that supports rapid recovery and positive outcomes.
How do you coordinate patient care with other members of the healthcare team in an outpatient setting?
In the dynamic outpatient setting, effective coordination with the entire healthcare team is paramount to ensuring comprehensive and seamless patient care. My approach centers on proactive communication, clear documentation, and a shared understanding of patient goals. My primary liaison is often with the physicians. This involves not just receiving orders, but actively participating in rounds or daily huddles, providing succinct updates on patient status, relaying any new symptoms or concerns identified during patient interactions, and clarifying treatment plans. For instance, if a patient reports persistent nausea after starting a new medication, I would immediately flag this to the physician for a potential dosage adjustment or alternative prescription, rather than waiting for a scheduled follow-up. This proactive communication ensures timely intervention and prevents escalation of issues. With specialists, coordination typically involves facilitating referrals and ensuring a smooth transition of care. This means accurately relaying the referring physician's questions or concerns, providing relevant patient history and test results, and then following up to ensure the patient attended their appointment and that the specialist recommendations are incorporated into the main care plan. If a patient is seeing a cardiologist, I'd ensure the general practitioner is aware of any new cardiac medications or dietary restrictions. My collaboration with pharmacists is crucial for medication reconciliation, adherence, and patient education. I frequently consult with pharmacists to clarify drug interactions, understand optimal administration techniques, or address patient-reported side effects. If a patient expresses difficulty affording their medication, I would work with the pharmacist to explore generic options or patient assistance programs. Finally, integrating social workers into the care plan is vital for addressing the psychosocial determinants of health. If I identify a patient facing challenges such as transportation barriers to appointments, food insecurity, or a lack of support systems, I immediately make a referral to the social worker, providing them with a clear summary of the patient's situation and needs. This ensures that non-medical factors impacting a patient's health are appropriately addressed, complementing the clinical care we provide. Throughout all these interactions, I leverage the electronic health record (EHR) as a central communication tool, ensuring all relevant information, updates, and discussions are clearly documented and accessible to the entire team. This holistic, team-oriented approach ensures that every aspect of a patient's care is coordinated, preventing gaps in service and promoting optimal health outcomes.
How do you ensure a smooth flow of patients through the clinic, from check-in to discharge?
Ensuring a smooth flow of patients through the clinic, from the moment they check in until their discharge, is critical for both patient satisfaction and operational efficiency in an outpatient setting. My approach involves a combination of meticulous planning, clear communication, and proactive problem-solving. It begins even before the patient arrives, with pre-visit preparation. I or the team will review the day's schedule, noting any patients with complex needs, requiring specific equipment, or those who might need extended time. This allows us to anticipate potential bottlenecks and allocate resources effectively. At check-in, the front desk plays a vital role in ensuring accurate demographic and insurance information is captured swiftly, and that patients are aware of the expected wait times. As a nurse, I often do a quick visual scan of the waiting area to assess for any visibly distressed patients or those who might require immediate attention, subtly adjusting my prioritization if necessary. Once the patient is called back, the assessment and rooming process is streamlined. I aim for efficiency without sacrificing thoroughness. This involves quickly obtaining vital signs, confirming their reason for visit, and updating their medication list and allergies. I use this time to set realistic expectations for their visit, briefly explaining the next steps. Effective time management within the exam room is key. I aim to complete all nursing tasks and preliminary assessments before the physician enters, allowing them to focus directly on the medical consultation. I also ensure all necessary equipment and supplies are readily available for any anticipated procedures, preventing the need to leave the room. Throughout the visit, communication is paramount. I maintain an open dialogue with the physician and other support staff, providing real-time updates on patient readiness or any unforeseen delays. If a patient is waiting for lab results or a diagnostic test, I keep them informed about the estimated waiting period. For discharge, my focus shifts to comprehensive and concise patient education. I ensure all post-visit instructions are clearly understood, including medication schedules, follow-up appointments, and any red flag symptoms to watch for. I always provide written materials and utilize the teach-back method to confirm comprehension. Finally, I confirm that any necessary referrals have been made and that the patient has a clear understanding of their next steps before they physically leave the clinic. By constantly monitoring the patient journey and proactively addressing potential hitches, I strive to create an efficient, patient-centric flow that minimizes wait times and maximizes the quality of care.
Tell me about a time you encountered a patient who needed a higher level of care than could be provided in the outpatient setting. What steps did you take?
A clear instance of this occurred approximately 6 months ago when a patient, Mr. Edward, presented for a routine follow-up after a recent bout of pneumonia. He had been discharged from the hospital and was expected to be recovering well. During my initial assessment, however, I immediately noticed several concerning signs that went beyond what we could safely manage in our outpatient clinic. His oxygen saturation was consistently fluctuating between 88% and 90% on room air, significantly lower than expected, and he reported increasing shortness of breath with minimal exertion, stating he felt much worse than even during his hospital stay. He also had a non-productive cough and appeared visibly distressed, with a slightly elevated respiratory rate of 24 breaths per minute. My immediate priority was to stabilize him as much as possible and ensure his safety. I quickly applied supplemental oxygen via nasal cannula at 2 liters per minute and continuously monitored his SpO2 and vital signs, which showed a slight improvement to 92 to 93% on oxygen, but still not at a safe baseline. I then promptly informed the attending physician about my findings, emphasizing the acute change in his respiratory status and the concerning SpO2 readings. While awaiting the physician, I remained with Mr. Edward, providing reassurance and keeping him calm. Once the physician assessed him, we collaboratively determined that he required immediate inpatient admission for further evaluation and aggressive respiratory support. My next steps involved initiating the transfer protocol. I contacted the admitting hospital to provide a detailed report on his condition, including his history, current symptoms, and our interventions. I ensured all his relevant medical records, including his recent hospital discharge summary and our current clinic findings, were prepared for transfer. I also made sure to clearly explain the situation to Mr. Edward and his accompanying family member in a calm and empathetic manner, addressing their anxieties and ensuring they understood why this higher level of care was necessary. I stayed with him until the ambulance arrived, providing a comprehensive handoff report to the paramedics, ensuring they were fully briefed on his current status and the care provided in the clinic. This swift recognition, escalation, and coordination were crucial in ensuring Mr. Edward received the critical care he needed promptly.
What are your thoughts on patient satisfaction in an outpatient setting, and how do you contribute to a positive patient experience?
A clear instance of this occurred approximately 6 months ago when a patient, Mr. Edward, presented for a routine follow-up after a recent bout of pneumonia. He had been discharged from the hospital and was expected to be recovering well. During my initial assessment, however, I immediately noticed several concerning signs that went beyond what we could safely manage in our outpatient clinic. His oxygen saturation was consistently fluctuating between 88% and 90% on room air, significantly lower than expected, and he reported increasing shortness of breath with minimal exertion, stating he felt much worse than even during his hospital stay. He also had a non-productive cough and appeared visibly distressed, with a slightly elevated respiratory rate of 24 breaths per minute. My immediate priority was to stabilize him as much as possible and ensure his safety. I quickly applied supplemental oxygen via nasal cannula at 2 liters per minute and continuously monitored his SpO2 and vital signs, which showed a slight improvement to 92 to 93% on oxygen, but still not at a safe baseline. I then promptly informed the attending physician about my findings, emphasizing the acute change in his respiratory status and the concerning SpO2 readings. While awaiting the physician, I remained with Mr. Edward, providing reassurance and keeping him calm. Once the physician assessed him, we collaboratively determined that he required immediate inpatient admission for further evaluation and aggressive respiratory support. My next steps involved initiating the transfer protocol. I contacted the admitting hospital to provide a detailed report on his condition, including his history, current symptoms, and our interventions. I ensured all his relevant medical records, including his recent hospital discharge summary and our current clinic findings, were prepared for transfer. I also made sure to clearly explain the situation to Mr. Edward and his accompanying family member in a calm and empathetic manner, addressing their anxieties and ensuring they understood why this higher level of care was necessary. I stayed with him until the ambulance arrived, providing a comprehensive handoff report to the paramedics, ensuring they were fully briefed on his current status and the care provided in the clinic. This swift recognition, escalation, and coordination were crucial in ensuring Mr. Edward received the critical care he needed promptly.
Describe your approach to providing culturally competent care to diverse patient populations.
In our increasingly diverse society, providing culturally competent care isn't just a best practice. It's an ethical imperative and fundamental to delivering high-quality, patient-centered care. My approach is built on 3 main pillars: self-awareness, continuous learning, and adaptable communication. Firstly, self-awareness is foundational. I begin by reflecting on my own cultural background, biases, and assumptions. Understanding how my own experiences might influence my perceptions helps me to identify and set aside any preconceived notions when interacting with patients from different backgrounds. It's about recognizing that my way of seeing the world isn't the only way, and critically, isn't necessarily the right way for someone else. This self-reflection allows me to approach each patient with an open mind and a genuine desire to understand their perspective. Secondly, continuous learning is crucial. I actively seek to expand my knowledge about various cultural beliefs, practices, and health perceptions. This isn't about memorizing every cultural nuance, which is impossible, but rather about understanding common variations in communication styles, family dynamics, views on illness and healing, and preferences regarding modesty or personal space. For example, knowing that some cultures may prioritize family decision-making over individual autonomy for a patient like Mr. Lee from a traditional Chinese background, or that certain communities, perhaps from remote tribal areas, might view health through a spiritual lens, helps me tailor my approach. I achieve this through ongoing education, reading, and most importantly, listening directly to my patients. I ask respectful, open-ended questions like, what are your family's beliefs about this illness? Or are there any traditional practices that are important to you during your recovery? This respectful inquiry demonstrates my commitment to understanding their individual needs. Finally, adaptable communication is key. This involves more than just language. It encompasses nonverbal cues, the presence of family members, and the method of delivering information. If there's a language barrier, I always utilize certified medical interpreters, avoiding family members unless absolutely necessary, and with a patient's explicit consent to ensure accuracy and maintain confidentiality. I also pay close attention to nonverbal cues, recognizing that direct eye contact or touch can be interpreted differently across cultures. My communication style is flexible, adjusting my pace, tone, and complexity of language to suit the patient's individual needs. My ultimate goal is to build trust and ensure that every patient, regardless of their background, feels understood, respected, and receives care that aligns with their values and beliefs.
A patient presents to the clinic complaining of sudden, severe chest pain. What are your immediate actions?
Upon encountering a patient like Mr. Jacob complaining of sudden severe chest pain in the outpatient clinic, my immediate actions would prioritize rapid assessment and stabilization, recognizing the critical nature of this symptom. My very first step would be to ensure his safety and comfort by having him immediately sit or lie down in a quiet, private area, minimizing any exertion. Simultaneously, I would activate the clinic's emergency protocol, alerting the physician or charge nurse to the situation, as time is of the essence in cardiac events. While waiting for additional support, I would quickly perform a focused initial assessment. This involves rapidly checking his vital signs, blood pressure, heart rate, respiratory rate, and oxygen saturation, and assessing his level of consciousness and skin color. I would also ask brief, targeted questions about the pain, its onset, character, e.g., crushing, sharp, radiation, any associated symptoms like shortness of breath, nausea, sweating, or dizziness, and any relevant medical history such as a history of heart disease or risk factors. This immediate information gathering helps to quickly differentiate between potentially life-threatening cardiac events and other causes of chest pain. If his oxygen saturation were low, I would promptly administer supplemental oxygen via nasal cannula. I would also establish for access as quickly as possible, anticipating the need for medication administration and fluid resuscitation. Throughout this rapid assessment and initial intervention, I will maintain a calm and reassuring demeanor, providing verbal comfort to Mr. Jacob and clearly explaining each step I was taking to reduce his anxiety. All findings and interventions will be meticulously documented, ready for a seamless handoff to the physician or emergency medical services. My ultimate goal is to facilitate the quickest possible transfer to a higher level of care, such as an emergency department, where definitive diagnosis and treatment for a potentially life-threatening condition can be initiated.
You are responsible for a patient who has just received an injection and starts to show signs of an allergic reaction. What would you do?
Given the scenario where I'm responsible for a patient who has just received an injection and begins to exhibit signs of an allergic reaction, my immediate response would be swift and systematic, prioritizing the patient's safety and well-being. Let's say, for example, Ms. Mihiraa, who just received a routine vaccination, suddenly complains of itching, develops hives, and reports a feeling of tightness in her throat. My first action would be to immediately stop the administration of any further medication if it were an infusion, or simply note the time of reaction if it was a single bolus injection. Concurrently, I would rapidly assess her vital signs, including blood pressure, heart rate, respiratory rate, and oxygen saturation, and quickly observe for any other alarming symptoms such as swelling of the lips, tongue, or face, wheezing, dizziness, or a sudden drop in blood pressure. While performing this rapid assessment, I would immediately call for help, alerting the physician or charge nurse and stating clearly that the patient is experiencing a suspected allergic reaction. If Ms. Mihiraa were showing signs of anaphylaxis, e.g., severe respiratory distress, significant hypotension, my next immediate step would be to administer epinephrine intramuscularly, if it is available per clinic protocol and within my scope of practice. I would also elevate her feet if her blood pressure was low, or position her for ease of breathing if she had respiratory distress. Following this initial critical intervention, I would ensure a patent airway and continue to monitor her vital signs closely and continuously. I would stay with her, providing reassurance and maintaining a calm presence, while also ensuring that the crash cart or emergency medications are readily available. All actions taken, including the time of the reaction, specific symptoms, vital signs, and any interventions like epinephrine administration, will be meticulously documented. My overarching goal would be to stabilize Ms. Mihiraa and, if necessary, prepare her for rapid transfer to a higher level of care, such as an emergency department, to ensure she receives immediate and comprehensive management for the allergic reaction.
A patient is extremely anxious about a minor procedure they are about to undergo. How would you support and reassure them?
When a patient, let's say Mr. Chris, is visibly anxious about an upcoming minor procedure, my primary goal is to provide empathetic support and reassurance, recognizing that their emotional state can significantly impact their experience and even the procedure's outcome. My approach will be multifaceted, focusing on communication, education, and creating a calming environment. Firstly, I would initiate a calm and unhurried conversation with Mr. Chris. I'd sit down, make eye contact, and use an open, reassuring posture. I'd acknowledge his feelings by saying something like, "Mr. Chris, I can see you seem a bit anxious. It's completely normal to feel that way before a procedure, even a minor one. What specifically are you most worried about?" This open-ended question encourages him to articulate his fears, whether it's pain, the unknown, or a past negative experience. Once I understand his specific anxieties, I would then pivot to patient education tailored to his concerns. If he's worried about pain during the skin biopsy, I would explain in detail the local anesthetic, describing the sensation he'll feel, a brief sting, then numbness, and assuring him that we will ensure he's comfortable throughout. I might say, "You'll feel a small pinch as the numbing medicine goes in, but after that, the area will be numb, and you shouldn't feel any sharp pain. Please let us know if you feel anything, and we can add more numbing medicine." I would walk him through the steps of the procedure in a clear, concise manner, telling him what to expect at each stage, thereby demystifying the process and reducing fear of the unknown. I'd avoid medical jargon and use simple, relatable language. To further enhance his comfort, I would employ distraction and relaxation techniques. This might involve engaging him in light conversation about his interests, playing calming music softly if available and appropriate, or guiding him through simple deep breathing exercises. I'd encourage him to take slow, deep breaths, perhaps counting with him, as this can physiologically reduce anxiety. Throughout the procedure, I would maintain a continuous dialogue, checking in on his comfort level frequently and providing updates on our progress. My presence and continuous reassurance are key, ensuring Mr. Chris feels supported, informed, and ultimately much calmer throughout his experience at our clinic here.
You have a long waiting list of patients, and an urgent add-on patient arrives unexpectedly. How do you manage the schedule and communicate with other patients?
In an outpatient clinic, an unexpected urgent add-on patient when there's already a long waiting list presents a significant challenge that demands immediate and strategic management to balance patient care with operational efficiency and patient satisfaction. My first priority would be to rapidly assess the urgency of the add-on patient. While they are labeled urgent, I'd quickly gather key information to determine if they are truly emergent and require immediate attention over existing scheduled patients, or if their condition, while acute, can tolerate a brief wait. This brief triage helps me understand the gravity of the situation. Simultaneously, I would communicate immediately with a physician or charge nurse about the new patient's arrival and their assessed urgency. Collaborative decision-making is crucial here, We would quickly determine the best course of action, where to fit them in, which resources might need to be reallocated, and which scheduled patients might be impacted. Once a plan is established, transparent and empathetic communication with the other waiting patients becomes paramount. I would identify patients whose appointments might be directly affected by the add-on. Approaching them individually and privately, I would explain, "We had an urgent medical situation arise that requires immediate attention. This means there will be an unforeseen delay, and your appointment might be pushed back by approximately X minutes. We deeply apologize for this inconvenience and appreciate your understanding as we ensure everyone receives the care they need." It's important to convey that while their time is valued, patient safety is our highest priority. I would also offer options if feasible, such as rescheduling for later in the day or another day if their issue is not urgent and they prefer not to wait. For those who choose to wait, I would provide updates periodically to manage their expectations. Internally, I would readjust the schedule proactively. This might involve identifying opportunities to streamline other patient visits, cross-train staff to assist where needed, or strategically utilizing available rooms. The goal is to minimize the ripple effect of the add-on on the entire clinic flow, ensuring that while the urgent patient receives care, the disruption to others is as minimal and well communicated as possible. This approach ensures patient safety while maintaining transparency and managing expectations across the board.
A patient calls with a complex question about their medication. You're unsure of the exact answer. What steps would you take?
When a patient calls with a complex question about their medication, and I'm unsure of the exact answer, my priority is to ensure they receive accurate and safe information without delay, while also upholding my professional responsibility. My immediate step would be to avoid guessing or providing speculative information. I would calmly and reassuringly tell the patient, "That's an excellent and important question, and I want to make sure I give you the most accurate and complete information." To do that, I need to consult with a physician or a pharmacist to get the precise details for you. This approach conveys honesty, professionalism, and a commitment to their safety, which builds trust. While the patient is on the line, or after asking for their best contact number if they prefer a callback, I would then swiftly consult the appropriate resource. This typically means reaching out to the prescribing physician directly if it pertains to a specific aspect of their treatment plan or an unusual side effect. For general medication information, drug interactions, or dosing clarifications, my first line of contact would be our clinic's pharmacist, or if unavailable, I would utilize reliable medical resources such as a comprehensive drug reference guide or an online pharmaceutical database. I'd specifically look for the exact scenario or interaction the patient is asking about. Once I have the verified information, I would call the patient back promptly or provide the answer if they held on the line. I would explain the answer clearly, using language they can understand, and confirm their understanding by asking if they have any further questions or if they'd like me to re-explain anything. For example, if Mr. George called about a specific interaction between his new blood pressure medication and a supplement he takes, I would explain whether they can be taken together, if timing is important, or if one needs to be stopped, based on the verified information from the pharmacist. I'd also document the patient's question, my consultation, and the advice provided in their electronic health record to ensure continuity of care and for future reference. This systematic approach ensures accuracy, promotes patient safety, and reinforces patient confidence in the care they receive.